Colorectal cancer is simply a cancer growth occurring in your large intestines, specifically your ascending colon, your transverse colon, and your descending colon and rectum. Usually, the signs and symptoms of colorectal cancer are number one, bleeding, unexplained weight loss, changes in your bowel movements like alternating constipation and diarrhea lasting for about 4 weeks or more. And then there's also passage of blood in the stools and sometimes changes in the caliber of your stools. Factors that could cause the colorectal cancer, like for example, older age, not necessarily male or female. Then there's the African American descent or Black Americans. They have a high propensity to develop colon cancers. Low fiber, high fat diet, sedentary lifestyle, and even family history of colon cancer. Well, there are several treatment options for colorectal cancer. Usually it is based on the stage of the patient when we do the treatment. Here at Medical City, we usually develop a multidisciplinary team approach in dealing with colorectal cancers. Not just colorectal cancers, even for other cancers as well. We have a team composed of different specialties, ranging from the surgeon, gastroenterologist, a medical oncologist, radiation oncologist, and even a stoma and wound care nurse, and even a dietitian. So the team would look into the patient's condition, stage of the patient, and total well-being, and we will develop a treatment plan for the patient that would cater specifically for each patient. Usually, before we commence treatment, we start with the diagnostics. Once we were able to fulfill the criteria for colorectal cancer, we talk to the patient and to the relatives and discuss the different treatment options that are specifically targeted for each patient. We can mention like surgery, chemotherapy, and radiotherapy. The primary role of the stoma nurse in colorectal cancer is providing care to patients with stoma, like with colostomies after surgery. They play an important role in improving the quality of life of each patient with the stoma, because there is a stigma that patients with colostomies are having difficulty moving their bowels. So the role of the stoma nurse is to provide adequate care on how to care for the colostomy, thus improving the quality of life of the patient. It doesn't mean that patients with colostomies are already terminally ill. It's just that sometimes the location of the colorectal cancer is way below the anal sphincters, that there's no chance of preserving the anal sphincters, so might as well we have to divert the fecal material into the abdomen. That's why the role of the colostomy nurse is to educate on how the proper handling of colostomies, and even the changing, and even other than changing, even the care of colostomies. Here at the Medical City Clark, we have a complex wound and stoma care center wherein there is a dedicated stoma nurse that will provide education and care for each patient with undergoing surgeries for colorectal cancer who will need colostomies in time. So we have a dedicated nurse that was trained in the proper care of colostomies, not just colostomies, even other stomas such as nephrostomies or ileal conduits. It's not limited to colorectal cancer.
I'm April. I'm the stoma nurse. So our center is located at the OPD area beside ER, the Medical City Clark. So I'm responsible for health education and the changing of colostomy bag of our patients. And then we have our services offered. We have pre and post-operative counseling, and we have stoma sighting, and we also have colonic irrigation. And at the same time, you can also avail the merchandises that we have. We have different sizes of colostomy bags and colostomy wafer. We have sizes 40, 50, and 70. And we also have colostomy paste and colostomy powder. Our Stoma and Complex Wound Care Center is open during Tuesdays until Saturdays from 8 a.m. until 5 p.m.
I'm Dr. Noelito Lacsamana, General and Laparoscopic Surgeon.
I'm April Bancore, your Stoma and Wound Care Nurse. Your partners in health.